In ECG, one box having 1 millimeter height, one box equivalent to 0.1 millivolt. The large box, the large box square is 5 millimeter in height. This is 5 millimeter in height. So it have 0.5 millivolt. The small box takes 0.04 seconds, where the big box takes 0.20 seconds. Electrocardiogram or ECG or EKG is a recording of electrical activity of the cells of the heart throughout the cardiac cycle. It helps evaluate the rate, the regularity, and function of the heart. As a pattern of rhythm recognition, you will be reviewing the normal ECG with ACLS cases, basic reading. So this is a small box which have 0.2 seconds with 0.5 millivolt, a big box which have around 0.4 0.5 seconds with 1 millivolt. So the small square 0.04, five small squares, which have 0.2, five large squares is 1 second, one small is 0.1 volt, one large is 0.5 millivolt, small is 0.1 millivolt. So the rhythm consists of, first is the P wave, then Q, then R, then S, then T, and then U. So starting from P to Q is the PQ interval. From QRS, this is QRS complex. From Q to T, this is QT interval. And from S and T, this is ST interval. So these are the parts of ECG. Now we learn about the waves. The P wave, which is used for arterial depolarization or the contraction of the arteriums or the heart. The small round waves and usually have duration 0.8 to 0.10 seconds. This one is 0.8 to 0.10 seconds. Then we go to QRS complex. QRS complex is the second deflection position, positive deflection after P. These are positive deflections, these are negative deflections. So this positive deflection, it represents the ventricular depolarization. So the P wave is for arterial depolarization, and QRS complex, this is ventricular depolarization or contraction of ventricles. In the QRS complex, measurement from the point at which Q leaves the isometric line to the point at the S returns to the isoelectric line. So the Q and S returns to the isoelectric line. This is normal QRS complex, and this duration is 0.06 to 0.12 second. So the P wave is 0.08 seconds to 0.10 seconds, and from Q to S, the QRS complex, this is 0.6 to 0.12 second. Ventricle is big, so 6 to 12. This is doing small to 8 to 10, 8, 9, 10. So it's like small. From 6 to 12 is big gap. So big thing takes big time. Big thing takes big time. Now the T wave. T wave is the upward deflection. Okay. This is ventricular repolarization. Like the ventricle is repolarizing or coming to the initial state. This is T deflection. Deflection. Now S to T. ST segment. From S to T. This one. this one. ST segment is the ECG represents the segment from the end of QRS complex to the beginning of the T wave. From the end of QRS complex till the beginning of the T wave. This is ST segment. This is it is an isoelectric line. Okay, this is an isoelectric line representing isoelectric period when the ventricles are in between depolarized and repolarized. This is the time when the ventricles are between the depolarized and the repolarized state. At this point, all myocardial cells in the plateau phase of the action potential. All myocardial cells in the plateau phase. So this ST segment, this is when the QRS complex ends. QRS complex ends and the T starts. This is ST segment, which is between repolarization and depolarization state. All myocardial cells are in the plateau state. There is a J point, the junction between the end of QRS complex and the beginning of ST segment. End of QRS complex and the beginning of ST segment. There is a small J wave. What is this? At this point, QRS complex stops. Okay, stopping of QRS complex and makes sudden sharp change in the direction. This junction between the end of ventricular depolarization and the beginning of ventricular repolarization. So this one is ventricular depolarization changing to ventricular repolarization. The PR interval. The PR interval is the time interval begins from P wave, the onset of arterial depolarization, till the beginning of QRS complex or the ventricular depolarization. So arterial depolarization to ventricular depolarization per se नीचे. The time for this, the electrical impulse generated from SA node travels through the atrium or through the artery across the atrioventricular node to the ventricles. Normally, it takes 0.12 to 20 seconds. So, from the blood will come from the atrium to the ventricle, and the electrical impulse will pass from AV node from the SA node to AV node. So, this thing is happening in this phase P to Q. So this is P to R till that time. So this is PR interval. Okay. This, and it takes 0.12 to 0.20 second duration. There is an U wave, small deflection after T wave. Okay. This may not be always seen. May not be always seen due to its small size. Exact cause of U wave is unknown, but it is thought the represent the repolarization of the Purkinje fibers in the ventricles. Okay, repolarization of the Purkinje fibers of the repolarization. Thank you for now. Once more, the last time there is a P wave, which is positive deflection, takes 0.08 seconds to 0.10 seconds. Then from P, Q, R, S. This is QRS complex. From P to R, that is PR interval. This is when the SA node to AV node and to ventricles, the electrical impulse is going and the blood from atrium to the ventricle it's going. This is atrial depolarization or the contraction and then the ventricular contraction. So this takes 0.08 to 10 second. Then blood comes to QRS complex in the ventricles and QRS complex takes 0.6 to 0.06 to 0.12 seconds. PR interval from the blood traveling from P to R or the atrial contraction to the ventricular contraction. This takes 0.12 to 0.20 seconds. Then QRS complex from S to T. S to T. This is the time between depolarization and the repolarization. All the myocardial cells are in a plateau phase. And there is a J point where there is a positive deflection towards the repolarization. The T wave is the upward deflection for the ventricular repolarization, and the U wave is very small, so sometimes cannot be seen, but this is due to repolarization of Purkinje fibers.